I am here to talk to you about pre-anesthetic assessment. My goal here is simple. I want to give you information that is going to help you feel better prepared and to manage your anxiety and fears before an operation, should you or your loved ones need one. My name is Dr. Daphine Atukwase. I am a senior resident of Anaesthesia and Critical Care at Makerere University. What do we mean when we say pre-anesthetic assessment? So we all know that the safest means to travel is by air transport, and this has only been made possible because the pilot performs multiple safety checks before the plane to ensure that the plane takes off in the safest, best condition. Now, this is the same thing with having an operation. So a pre-anesthetic assessment is that pre-flight check on our end before your operation. It's a series of checks to ensure that you're in the best shape possible before your operation. It's a medical consultation done before your operation where a trained anesthesia provider reviews your health, your history, your medications, examines you, and plans the safest possible anesthetic care for you. So when we say pre-anesthetic assessment, what do we do during this time? So we ask questions about your overall health. We ask about your previous experiences with anesthesia. We check all your current medications, including traditional or herbal medicines, supplements, and vitamins. We also ask if you have any allergies. We also do a thorough physical examination. We review and order any relevant tests. And then we go ahead to explain your options for anesthesia and the associated expectations. And then we also give you an opportunity to ask questions and raise your concerns and have them answered. So, when you find yourself that you need an operation, what should you do? We know that needing surgery is overwhelming, okay? And it is normal and expected for you to feel frightened, confused, or unsure of what to do next. So here is what you should do. First, do not panic, okay? Find out from your surgeon what type of surgery it is you're going to have and when it is planned, okay? And then carry all your medicines that you're taking, both prescribed and traditional. Carry all your medical records, especially if you have a chronic disease, like hypertension, heart disease, or diabetes. And then insist on meeting with your anesthesia provider ahead of the planned surgery date. This could be in a formal pre-anesthetic clinic, or it can be in any other room, okay, or ward where this consultation can happen. And you can also bring a trusted family member to this pre-anesthetic assessment. Write down any questions, concerns, or queries that you could have that you might want the anesthesia provider to address during this consultation, okay? So, why do we need to have this pre-anesthetic assessment done, okay? The major reason is to have you in the best possible shape before your operation, and this ensures utmost safety, okay? Helps us identify medical problems before your operation and sort them out in due course. It also avoids last-minute cancellation due to inadequate preparation. Research has shown that people who attend a pre-anesthetic assessment clinic have fewer complications and better post-operative outcomes. It also helps us prepare an individualized anesthesia care plan, keeping in mind your specific needs, okay? All this is just to make you feel better, less anxious at the end of the day, okay? So, when should you go to the pre-anesthetic assessment? Anytime that your operation has been confirmed, you should have your assessment. And ideally, this is going to be preferably between 1 to 2 weeks before your operation date. This allows us enough time to carry out examinations and to do tests, as well as refer you to other specialists, okay? And if you're having an emergency surgery, we shall do a rapid bedside assessment due to the urgency of the operation, okay? So, people that need to attend the pre-anesthetic assessment much earlier than 1 to 2 weeks, this is going to be people that have chronic illnesses, and their assessment should go on as early as 4 to 6 weeks. And these are people with high blood pressure, especially if it's poorly controlled, diabetes, heart disease, history of heart attack, patients with lung conditions such as asthma, TB, or smokers, patients with kidney or liver disease, HIV-positive patients, obese patients, patients taking blood-thinning medications or those who have bleeding disorders, patients with previous difficult anesthesia experience, elderly patients, those above 60 years, especially if they're undergoing major surgery, and then pregnant patients requiring operations other than the cesarean sections, as well as patients who are receiving or have received cancer treatment in the past. So if you belong to any of the groups I've listed above, please insist on seeing your anesthesia provider immediately the surgery is planned, because you need more extensive assessments and examinations than prior, okay? So just in case you missed anything in this talk, you should leave this talk knowing 4 major things. 1, a pre-anesthetic assessment is important to help you get in the best shape possible before an operation, okay? It ensures proper planning and preparation for your anesthesia and your operation. Also, once your surgery has been planned for you, insist on meeting your anesthesia provider before the day of the surgery. And lastly, bring a family member to this pre-anesthetic assessment consultation, because it can be overwhelming. If you have any further comments or questions, post them in the comment section and we'll get back to you in due course. Thank you very much.